Obstructive sleep apnea is basically a repetitive collapse of the upper airway, and it happens during sleep. Apnea is basically happening because all the soft tissues in the mouth usually collapses when you are in deep sleep and completely closing the airway or making it so narrow that a patient cannot breathe through it. Yes, definitely. You can snore and not have sleep apnea. Snoring is basically deemed as a social nuisance. It's just a loud noise, but it doesn't necessarily that you have sleep apnea with it. If you have sleep apnea, you can snore, and there are many patients we have seen who have sleep apnea and do snore, and many of them who snore only but doesn't have any sleep apnea accordingly. So the mandibular advancement splint works in a way it actually holds your mandible forward. Either it can be a pull or a push motion, but it actually does it. It pulls your mandible forward and holds it there for the whole night. So making your airway bigger at the back so you can easily breathe, reduces your snoring as well in that way. So if it is fitted correctly, it's very comfortable. So initially there is a little bit of discomfort expected. It's like 3 to 5 nights. And with a couple of remedies we see to them and give it to them, they overcome with that one. And if it is fitted by a professional dentist and it is a custom made one, it can be very fine tuned and adjusted as well. So it helps the patient to get over the initial hiccups they have. And I'll put it as more like a discomfort rather than being uncomfortable or sore or pain. Yes, so what happens initially when we make the device, we give it to the patient to wear it and make sure that any discomfort which they experience in 1 or 2 weeks time, we need to sort them out. So it makes them more compliant to wear a splint all night and they can use the device for the rest of their life. But we like to review them after every periodic, maybe like 6 months, 1 year, 2 years, depending upon how good they are with the splint, how do they wear the splint and how compatible they are with the splint. We customize it to the patient wise. If they are having a lot of discomfort, we see them more regularly than the other patient, but usually we like to review them till they are using the modality to treat them or to the rest of their life.